My name is LaShae Roll. I was diagnosed with multicentric breast cancer. I currently live in Miami, Florida, but I was born and raised in Nassau, Bahamas. So I am a Caribbean girl, and I'm actually doing my PhD in cancer prevention research. So funny enough, like I'm doing what happened to me. I just want to say, like, it's very important to advocate for yourself because had I not been that person, I wouldn't have been scanned. I wouldn't have had that done. And like, who knows? It would have been growing more, and I might not have found out about it until it was either stage four or too late, basically. So before I was diagnosed in 2022, I basically found a small lump. It was about this big, and I didn't think much of it, but I did a little internet search and alongside some of my master's degree searching for actual research because I was taught how to do research. And what I found was that if the lump was movable, it had a lower likelihood of being cancerous. And so my own was movable at that time. That was right before I started my PhD. And so I said, okay, you know, nothing to worry about. And I hadn't even really been doing much cancer research. I got into this through looking at obesity research. And now I'm at the parallel where we're looking at exercise and diet and how it can impact cancer outcomes. So I was still a baby when it comes to cancer research. So that's like a big reason I think I pushed it to the side. And then when my PhD started, it's a lot. I mean, for anyone who has done any graduate degree, I'm sure it was just a lot thrown at me at once. I wanted to be the best student I could be, the best person I could for my new lab that I was in. And so I really prioritized those. Those were number one. And sadly, for a lot of us, health is kind of on the back burner. And so I literally forgot about that. And I'm also a power lifter. I didn't mention that. And so I bench press close to 300 pounds. So if I feel any tension or pain in my chest area, I'm thinking it's probably that. And so late 2023. So that's when I felt a lump again. And I was like, wait, is this that same thing? And I still to this day don't know if it was the same thing, but it went from that size, if it is the same thing, to about this size. And I was like, something is wrong with that. And I felt pain. And the pain was what really alerted me because, when anyone feels pain, like you're going to get alerted. And so what happened next was I was like, I need to go and do my annual. I need to go and do a wellness exam. So I scheduled a wellness exam and I had to keep postponing it because I had a lot of tests and things coming up for my degree. That literally, my degree is what consumes and consumed my whole life since I began it. And so I finally got in to go and do that in early January 2024. So, took a while. And when I got in, the doctor who was there, I'm at the student center, by the way. I did this all at the student center. When I got in, the doctor basically did a mammogram. No, not a mammogram. She did a pap smear and she did vitals, all those basic things you would do at a wellness exam, but she didn't perform a breast exam. And when she was about to leave, she asked me basically, is there anything else on your mind? Is there anything pressing that you want to discuss or want me to do for you? And I mentioned that I had a lump. And she took it serious immediately because she put on gloves and she performed a breast exam. And, I mean, considering what her specialty is, she just does general practitioner work, things like that. She wasn't really sure what it was, but she put on the paper basically mass question mark. And she told me, I'm going to go ahead and be extra cautious and I'm going to give you a referral to get a ultrasound and a mammogram. And she gave me all the instructions and the things that I needed to do, told me where to call, and that was very helpful. Till this day, I think that visit and that doctor, she really, was a part of the team that saved my life. And when I called to schedule my ultrasound and mammogram, the person on the phone was like, "Whoa, you're really young. You want to schedule a mammogram and a ultrasound? Are you sure you want to do this?" Like, and I was like, "Yeah, I do." And she's like, "Well, do you even have any symptoms?" And I was like, "Okay, can you list off some of the symptoms for me?" And she listed them off. And I was like, yeah, I have a palpable mass and I have pain. And she's like, oh, okay, well, we're going to just only schedule the ultrasound because you don't need a mammogram. You're too young. And I was like, okay, well, just do whatever you need to do. But, I just went ahead and did that because in my head, like that conversation, like if I wasn't the person who I am, like I'm a person who's like very persistent and cautious. And like at this point in time, I was taking this serious. And so, I was like, I'm going to waste your time. You might think that I'm wasting your time because I'm too young and you probably think, oh, you can't get cancer, but I'm going to waste your time. I went in and I to go do my ultrasound, and you have a checklist. And so on the checklist, one thing I want to note is that they asked me if I was of Bahamian descent. So I am from the Bahamas. And that's because, the people women who are from the Bahamas have a higher likelihood of getting breast cancer and having more aggressive cancers due to the BRCA mutations, among other mutations that are not even well known right now. And so I checked that, and then I was like, this is good. The researcher in me is thinking, this is really good. I'm very proud of the cancer center. But, after that, when I went in, they were like, okay, you're only doing an ultrasound. This is going to probably take about 15 minutes. And so when my name was called, I went in and the tech put the liquid, the little clear fluid on me and started the ultrasound. And the second, like she put the wand on, she was like, and then the person who was assisting her was like, and I'm like, oh, okay. Like, I know there's something there because it's palpable. I can feel it. But I'm like, what's going on? And like, they just, every time they see a quote unquote mass, they would take a picture and measure. And so every minute I'm seeing picture, measure, picture, measure. It was like 10 of those they did. And then they were like telling me basically, how long have you had this? How long have you had these masses? And I'm like, masses with the S plural? I was like, as far as I know, I just have that one lump. And, it just kept doing it more and more. And then before the ultrasound even ended, they had to bring in someone to help them to go and do the 360 view because they said they haven't really done that. The tech who did that has never done the 360 view. They had no need to do that. And the person in me, like, who knows about cancer as someone who's pursuing cancer research is like, so that means it's just spread all over the place. It's like in 4 quadrants or something. And then they went over to the left. They was like, let me check the left. And then it was nothing there. That was quick. They didn't do any pictures of measure. Then they came back to the right. And then they got another person to come in to go and help. And I'm like, they're doing all this stuff. This was supposed to take 15 minutes. We're like, this is like 45 minutes now. Then I started to gather my stuff and my clothes to leave. And they were like, no, you can't leave. We're about to do a mammogram now. You need to do a mammogram. And so then I immediately got pushed to the line. Like, you have to make appointments for this. I immediately went to do a mammogram that same day within like 2 minutes. They took me in and, I gathered my stuff again to go and leave. And they were like, no, you can't leave. I was like, y'all not going to just like call me with the results or something? They're like, no. The radiologist is going to talk to you right now. They're going to talk to you today before you leave. So then they took me to a quiet room. And I was like, this is like a movie. When they take people to a quiet room. This is all in the same day, by the way. Then the radiologist comes in and she's like, you have multiple calcifications all throughout all 4 quadrants of your breast. And I'm like, what? Like, I'm like, are you serious? Like, I really couldn't believe that. Like, so basically how I was feeling was I was like in that room and I was there and I was like starting to get dizzy. I was like, I can't even believe this because I'm someone who power lifts like daily. I just a couple weeks ago bench pressed 292 pounds, squatted 440 pounds, deadlifted almost 500 pounds. And I had to get drug tested because it was so good. I had such a good competition. And then you're telling me while I'm doing this, I had these calcifications because that's what they're calling it at the time. They won't tell you that you have cancer unless they're certain. So then after that, I was just like, what's next? Because like they start looking at you like with that pity look. And I'm like, what's the next step? And they was like, you need to do a biopsy. And then when I looked in my chart, my chart popped up and it was like back populated. And I saw the notes from the first like ultrasound and mammogram. And it said basically fine calcifications throughout all four quadrants of the breast, spanning 12.7 centimeters. 12.7 centimeters. And then it said it was in my lymph nodes. And then it also said that I was BIRADS 5. And so I looked up what BIRADS 5 mean. And so that means you have a 95% chance, at least a 95% chance of having cancer. So they're predicting it's 95%. That's the lowest, like 95 to 100% chance you have cancer. And I'm like, I'm now just waiting for the results, and I'm stressed out, like, because in my head I'm like, I'm a stats person. You got to keep going back to that. I'm like, so I have this, and so Monday rolls around, and that's like, what is that? 3 days later, Monday rolls around, and I get a call, and they're like, hi, I'm calling about your results. And they asked me if I had a place to sit. And I was like every time they always give you hints, like, and I'm like, no, let me try to find a place. They're like, we can call you back if you like. And I'm like, no, don't call me back. You already just made my brain just explode. Like what's going on? And then the doctor lets me know that she doesn't have good results and it was malignant. And then I was like honestly, when I found out the results, I actually felt a little better than all that anxiety of trying to figure out like, what do I have? What is this? Because like what runs through your head is like, is this stage 4? Like, is this in my brain? Like when I got a headache, I was like, is this in my brain right now? So like hearing that was actually kind of a relief. So after I was diagnosed, the second I got that phone call, not 5 minutes had passed before the medical oncologist, no, before the surgeon's office had called me. And I made an appointment, and I also had a breast MRI scheduled. So I went ahead and I did the breast MRI. It was very uncomfortable, by the way. And they let me know from the results, basically, that it was confirmed I do have widespread cancerous looking things all throughout my breast, and they're seeing something in my lymph nodes, and they're seeing multiple tumors, because again, I was diagnosed with multicentric breast cancer. And so what that means is that it was in all four quadrants of my breast. And I was like, interesting, because I know just my age alone, it's rare. Less than 1% of all cases are for females who are in their 20s. So then after I did the MRI, I saw the surgeon, and the surgeon let me know, because she saw the results, that basically you don't have, much options when it comes to the surgery, because it's in all four quadrants of your breast. Because usually people can do a lumpectomy, they can do certain types of mastectomies, like a skin sparing or a nipple sparing. I had to do a simple mastectomy, so it's just like a flat closure along the way, along my from my sternum all the way to my um underarm, or axilla, what they call it. And so, I think that was kind of better than having to make a bunch of decisions. And she also let me know I was going to be doing a PET scan. And so after that appointment, I went ahead and I did a PET scan. And that is a more intensive type of test. So you can see way more stuff with that. And that's how we can see if it has actually spread. Like, it would help with staging. And so when I got the results from the PET scan, it had not spread. It was only localized to just my breast and the lymph nodes that were nearby, the axillary lymph nodes. And so that was a relief. That was a big relief. So after the MRI, I did a chest x-ray pre-surgery. Then I did EKGs, blood work, type and cross, all that stuff prior to surgery. And I worked out a lot. I want to prepare my body for the battle, because one of the things I know from the research that we do in my lab and what I'm learning is that as you go through treatment, which I'm going through right now, your body goes through a lot and you can lose muscle, and that's actually detrimental for your outcomes. And so I kept powerlifting and I kept retaining that muscle. And that's a lot of what I was doing in between right up to the surgery. All right, y'all, time to get the next step done. Did the lymphoscintigraphy yesterday. Now I'm going to do the surgery. Let's get it. Happy birthday to me. So I had my mastectomy on my 27th birthday. And, I think at first I was kind of upset, but I think it's a good thing because I'll always celebrate when they took this cancer out of my body. And, so after the mastectomy, my surgeon came in and she explained that, she removed the cancer. Two of my lymph nodes were found to be positive. And from what I know, like that's like a hit or miss. Like, based on the final pathology, I can either have chemo or not have chemo, but I would definitely need radiation. And so then I was passed off to the medical oncologist. I met with her after my surgery, and she's the one who's going to be, spearheading all of the chemo, radiation, hormonal treatments, and all that. And, she let me know from the get go that I would need chemotherapy. And, that's the standard of care. And I also would need radiation and hormonal treatment because my breast cancer was ER positive. So I'm going to need to be on, hormonal treatment for 5 to 10 years. And it was a toss up. I was either going to go on ACT or just TC. But chemo was needed because of the lymph nodes and my age, because the longer you live, the more likelihood you have for recurrence just simply because you're around longer. And so in the end, we decided to do TC based off of my results from the additional testing that we did. So we did a mammoprint, and I was found to be high risk for recurrence. So all that combined, I had to do chemo. And I'm currently undergoing chemo right now. So chemo, that was what I feared the most from the beginning. I'm talking when they told me I had calcifications. That was the fear. And I ended up needing to do it. So for my first chemo, I had to get there early because I was doing the scalp cooling. So we got the scalp cooling going, and it didn't take that long, and it wasn't as scary as you would think, like as it's going into your body. And they do give you a lot of pre-medications, and the Benadryl knocked me out. Like I had never taken Benadryl at that dose, and so I was dizzy and like sleepy. And it was good. It was good. Less than 24 hours after I had gotten the chemo, I went to the gym and I power lifted. I did squat, bench, and deadlift and other movements because I was like, I'm going to keep doing what I'm doing on my journey. And so I felt solid. But when I got home, that's when the side effects kicked in. Fatigue, fatigue, fatigue. That's number one. I had to shower and then I fell asleep for 18 hours. Like it was brutal for me. I started to get GI symptoms. It was not good. A lot of TMI symptoms like that. And what else? I got a headache and my whole body just felt sore. And I work out a lot, like I said. So I know what soreness feels like. It had nothing to do with my workouts. Like it was just a general, like full body, like soreness. And my bones were even hurting because I also had to take Zoladex to preserve my ovaries so that I'm able to have children after this. And so it was just a lot going on. And those symptoms lasted for about, I'd say, 5 days. And then now, as you see me, it's been a little over a week since chemo. I feel great. I was able to do a workout and not crash afterwards. And, so some of my biggest tips I would say for patients undergoing chemotherapy is, come in with an open mind. Don't be that scared. It is scary. Like, I mean, you're going to be scared. You're scared the whole time, but, just like, don't stress out because stress is not good. Stress is not good for you. It won't help with your outcome. And so just come in, and if you can, get some ice compression for your hands and feet to prevent neuropathy, depending on the type of chemotherapy that you're gonna have to get infused. So for me, I was Taxotere is something that has been linked to neuropathy. So I did that. And then also I would say try to like eat bland foods when you're going through it, but do eat. Eating is number one because if you don't eat, you're going to feel terrible. I mean, I know your stomach hurts. I know all these things are going on, but you got to eat something, because that was something I learned quickly. Whenever I wouldn't eat, I would feel terrible. When I would eat, I started to feel better. And so nutrition is so important. And then movement. So when you do feel good enough, go outside and take a walk. I'm not saying like do what I did 24 hours after chemo, but go and move, because it's been linked to way better outcomes. I think I'm in a unique situation right now as somebody who wants to do cancer research for their entire career and was in the middle of a PhD focused on cancer prevention. It was very surprising, but I think it helped me get to my diagnosis. I would not have taken this serious or even known that these were, alarm signs if I didn't have that base knowledge. So yeah, for me now, when I think about what has happened to me, all I think about is how I'm going to be a much better researcher, because I was already a person who was heavily wanting to only work with marginalized and disparity communities, like, because I just want to help those who needed help the most. Like, I've always believed in doing that and helping, the less fortunate. And so what this has done is opened my eyes to a new group that I had no idea was a part of, like, a disparaged group. So AYAs, adolescents and young adults. I am now gonna include them in anything that I do in research and want to do community work with that group. Because me being a part of that group, I understand now that these are unique circumstances. You're just starting your life. When you're a young adult, you are just starting your life. Right now, I'm in the middle of a PhD. Luckily, I was able to do that and continue. Some people cannot continue on and get their education. And then when you go into the doctor's office, you're the youngest. When I went into one of my appointments, the medical assistant literally was like, "Where's my patient?" And then I was sitting right there, but she didn't expect me to be the patient. Sometimes I go with my mom and they think she's the patient. And so this is very emotional, and it's very isolating, I think, because cancer in itself is isolating, but you're also like the only one who is like in your age bracket going through this when you go to doctor's offices, and people feel sorry for you. I feel like there's an extra I feel sorry for you because of your age. And so yeah, I'm doing my PhD during cancer. I would say it's going to make me a much better researcher. It's going to make me more invested, and it's going to make me an advocate. I used to want to be an advocate, but now I want to be like, a research advocate and living proof. I like that, living proof and thriving. Cancer is very emotional. Like when you get a cancer diagnosis, and all throughout the whole like process, because this ends up being a journey. It's not like 1 month you're done. It's like you're mad, you're sad, you're like emotions I can't even describe. And so the way that I deal with it is I just take deep breaths. Like, you know, my primary mentor that I have for my PhD, when I first told her that I was diagnosed with cancer, she would like say deep breaths, and that really helped. I joined my AYA support group. I'd say joining support groups are so vital because they are going through the same thing as me. They're saying the same thing that I'm saying. They went through chemo. They're at different stages of the journey. So they're able to basically kind of guide me and, help me just get on track, because like you're just so spacey when this is going on, because you're pulled in so many directions and it's just overwhelming. I know that Caribbean people tend to have more aggressive cancers, certain cancers, not all, and then they are diagnosed at younger ages. And so I had heard about this, like it's pretty well known, and at my cancer center, Sylvester Cancer Center in Miami, they ask that question ahead of time if you're of Bahamian descent, because they're aware of this. We're known to have the BRCA mutation and other mutations, but I did get that test done. I got the comprehensive panel done, 70 genetic tests, all linked to cancer, 70 genes linked to cancer. And it turned out I was negative for all. So right now, we have no reason. Like I have no idea why I have this, because all the common risk factors, like diet, exercise, age, smoking, drinking. I've never smoked in my life, literally. And genetics, I genuinely could not tell you why I got cancer. And I'm the first person in my family to ever get breast cancer. So I could not tell you at all right now why I got this. My overall message for someone who's watching this would be to advocate for yourself because only you know your body. A lot of people are trained, and we have doctors who are trained to diagnose and do things. And I do research, I know the stats, I know the numbers and what's not. But at the end of the day, if we just listen solely to the numbers, I'm not supposed to have cancer, I'm not supposed to get screened. So go and do that. I don't care how young you are, make sure you're going to your physicals every year, you're in contact with your doctors, and make sure you're moving your body. I think it's around 70% of all cancers are linked to obesity. So make sure you are eating well and exercising and just be the strongest you that you can be.